executive summary of the CQC report has been circulated, along with Imperial College NHS Trust's action plan, which I think was taken and discussed at their board meeting last week. So if people would want to introduce themselves, but just to mention, well, I'll mention who they are first of all. I think some people will be familiar to us, but others not. So from the CQC, I understand we've got, amongst other people, Professor Edward Baker, who's the Deputy Chief Inspector, Dr. Sanjay, and you'll have to forgive me if I pronounce this incorrectly, Krishnamurthy, Dr. Tracy Batten, the Chief Executive of Imperial College NHS Trust, Dr. Chris Harrison, who's the Medical Director of Imperial College NHS Trust, and Professor and Junior Dr. Janice Sigsworth, who's the Head of Nursing, is that correct, at Imperial College?
Yes, I don't think I'm a doctor. I'm happy to be Janice Sigsworth. I'm the Nurse Director and the Chief Nurse of the hospitals.
Okay, thank you. So I think that shall we start with our CQC colleagues? Sorry, we've also got Owen Davis from CQC as well. Perhaps if you'd like to do a brief introduction of yourself, and I think you're going to take us first of all through the slides that you have prepared to give us a bit of background effectively to what you did in terms of undertaking the inspection. And then I guess you'll move into some more points about your findings. Thanks.
Okay, thank you very much for inviting us to present the findings of the CQC report into Imperial College NHS Trust. This inspection took place last September, and it is part of a programme of comprehensive inspections of all 162 NHS trusts in England. We're about halfway through that programme now, so Imperial is about on the halfway mark, and this was part of our routine inspections of those trusts. We are taking a very radically different approach to inspecting trusts. It's a comprehensive inspection that takes place over several days, with a large team that visits most parts of the institution. The team is made up of experienced CQC inspectors, but also doctors, nurses, other healthcare professionals from other hospitals to give peer review, but also patients and patients' representatives, which we refer to as experts by experience. So it's a large team. I think it's 35 that was inspecting Imperial over several days during the announced part of the inspection, and then we went back several times later for unannounced inspections to inspect areas where we wanted further information about the trust. Now, we asked 5 key questions about the service we inspect, and they're outlined on page 2, on slide 2. Is the service safe? Is it effective? Is it caring? Is it responsive? And is it well led? And these 5 questions really define our approach and how we determine what quality healthcare is. So it's a much more comprehensive view about what quality in healthcare is that perhaps we've looked at before. And it's important to say we look at all these factors, and particularly leadership is an area we're looking at now really for the first time in terms of our assessment of quality of healthcare. The next slide outlines how we look at those, and on the fourth slide are the 8 core services we look at. We can't look at every service in every hospital, and of course Imperial has a big group of specialist services, and we didn't attempt to look at every specialist service. We looked at the core services of all acute hospitals, and they're outlined on that slide 4. So accident emergency, medical care, including care of the frail elderly, surgical care, including theatres, critical care, maternity and family planning, children and young people's care, end-of-life care, and outpatients. And so those are the core services that our report concentrates on. It's a very detailed investigation. We gather a lot of information about the organisation before we visit. We collect that information, and that helps determine the questions we ask when we're on site. When we're on site, we visit clinical areas, we talk to patients, and we talk to staff. And one of the things that's come out very strongly in these inspections is how honest and open staff are in telling us about what's really going on at the front line in healthcare. And this is really a very new view of healthcare that we've taken in this inspection process. We're not sitting around a board table looking at papers. We're actually talking to patients and staff in clinical areas and hearing about their experiences of care, good and bad. And so the inspection report, which is very detailed, I hope you've had a chance to look at it, it's several hundred pages, covering all the 4 sites we visited at Imperial, goes into detail about all those factors. There's 5 questions for the 8 core clinical services across the 4 sites. And we rate each area against each of the 5 questions, and the report gives the detailed evidence behind how we've come to those ratings. I'll ask Dr. Krishna Murphy to go through some of the more detailed findings now.
Thank you, Professor Baker. Thank you very much for inviting us here. When we go into any hospital, we try and rate them on a 4-point scale. We might